hit go live.
You're live.
We're live.
Oh, I didn't know. All right. Hello, everybody. Welcome to the VBF March 2026 Facebook Live. Sorry for technical difficulties and that we're lagging a little behind. We're using a new streaming service called StreamYard. Thank you, Debbie, for getting us started, and as usual, like you did last month and the month before. If you can see us, can you please text where you are from and your name, and we can answer your questions anytime you want. I have with me today, so I'm Dr. Linda, president and founder of the VBF, and today we have Dr. Anna Duarte. She is the founder and director of the International Birthmark Institute in Miami, and also the Children's Skin Center at the old Miami Children's Hospital, which is now Nicklaus Children's Hospital. I always say that because people still equate it as Miami Children's Hospital, even though it's Nicklaus. So thank you, Dr. Duarte, and welcome.
It's a pleasure to be here again. Great to see you and everyone.
I'm just looking to see us on my phone, and I don't see it yet. So I'm just going to go out and come back in and see if it populates you and I, so I know that it's on. I'm not seeing it on my phone. Are you seeing it, Deb? It shows the red thing. Oh, maybe now we'll see it because it shows the, no, I'm still not seeing us.
Well, it must, yes, it's there.
Okay, I don't see it. I'm looking. I see me from before, but I do not see us. So you're saying you're looking on our Facebook page and you see it? Because I still don't see it. Let me just switch out. It's got the live thing, says current vibe live, but it's not, I'm not seeing it on our Facebook page at all. So I don't know if you can look, Deb. I know it says we're live, but I'm not seeing us. I hope it's not on my personal page.
No, click on the VBF logo on the Facebook page there.
Oh, okay. Thank you. All right.
You're welcome. I'm gonna remove myself so you guys can have a wonderful conversation.
Okay. Thank you. Technical difficulty.
You.
Sorry, everybody. Hi, Kiana. Hi, Mustafa. We're still working out kinks with this new StreamYard. I didn't know I was supposed to tap the logo, but thank you, Debbie, for getting us on board. And thank you for those of you who have joined us. So Mustafa and Kiana, welcome. I know more people will be joining. It's only 6 minutes worth of hiccups, so that's not too bad. But anyways, I've already introduced the joys of Facebook. Yes, I've already introduced Dr. Duarte, so thank you. And, you know, while we're waiting for people to ask their questions, I'm not I'll be going to the ISFA meeting and hopefully getting some information. I know this weekend is the AAD meeting.
Correct.
And will you be going to that?
No, I'm hosting the clinic.
Oh, that's right. That's
Yeah.
right.
So
That's right. Dr. Duarte has the VBF free clinic is tomorrow. So Dr. Geronimus is presenting on his 5 and 5 plan, 5 laser treatments in 5 days. So one after the other, he's presenting on that. And then he's presenting on the combination of the Maria, that new device, with the Pro, and how he's sandblasting through some pretty intense birthmarks. So I didn't know it. You know, I'd like to hear how it goes. You know, maybe I'll hear from him. And there's the ASLMS is coming up. So, you know, it's important that we continue to try to, as I posted this week, reduce the misdiagnosis rate amongst our patients, because I'm repeatedly seeing children with port wine stains put on beta blockers because they think it's a hemangioma. And I don't know if you're seeing that, but it's a lot. I'm seeing it a lot.
I'm fortunately not seeing as much of it as I used to, but I just gave a conference last weekend and I emphasized the importance of accurate diagnosis because the treatments are so different. And in the very beginning, right, a port wine stain and a very superficial faint hemangioma might, it might be difficult to distinguish,
Right.
but the hemangioma will proliferate and the port wine won't. And you should know within a couple of weeks, really if you are dealing with a capillary malformation or, a little vascular tumor, which is the infantile hemangioma.
That's what I was going to ask you is your opinion, because I've been telling the parents when they post online or they send it to me and they're like, the doctor's not sure if it's a port wine or a hemangioma. I say, give it 2 weeks and you'll definitely know, because it'll raise up or it'll stay exactly the same. So
for the most part, yeah.
2 weeks and especially if they're already a couple days old or a week old, because by the time they're 3 weeks or a month, if it's a hemangioma, or you should be able to differentiate it. So Mustafa, I see you're on. Feel free to ask any question you want. We have Dr. Duarte for 51 minutes now, so ask your questions. And I'm sure you probably know about the changeover with Pierre Fabre. That it is a new company now.
No, actually.
Yes. Elon, I think is the name of it, or Eton. And I'll be seeing them, and I have a meeting coming up with them because they're taking hemangiol. They have the hemangiol. So, oh yes. Well, so Mustafa, you just type your question right in the comment box. So just type your question and we'll read it and Dr. Duarte will answer you. So that's how you participate. So just ask your question. Anyone who's on, I see there's people on, they're not asking questions, but all you do is in the comment section, say your name, which birthmark you're talking about, and where you're from, and describe the birthmark. If it's a child, make sure you tell us how old the child is, what treatments they've had, what type of birthmark, because we're not seeing the child. We need as much information from you as possible so she can give you a good answer. So I'm assuming he's typing his question right now. So yeah, a lot. I think I'm excited. I'm sure you might have seen it or maybe not aware with the 3 different BEST, MEST, and NEST, the 3 types of electrosclerotherapy that are now being used in Europe. And
for the AVMs?
AVMs and VMs.
Okay.
Venus. The Dr. Coletti just did a little girl that had been going to Dr. Richter for sclerotherapy, and he did one of the MES, the modified electrosclerotherapy treatments, and the venous malformation is gone. And it was like a huge area like this. And no blood, no cutting, nothing. It's just literally shrinking. While you look at Lily, you can see it like shrinking on her face. So I'm looking forward to, he's supposed to be presenting on that at the ISFA meeting. So Mustafa, we're still waiting to see your question. We're happy to communicate with you. I'm not seeing any. I don't know, Kiana, are you seeing any? Because I know Kiana's on. And I'm just looking in the comment section. Oh, there it is. Hi, Eileen. Hi. Okay, thank you for joining. Hi, Ivana. Thank you for joining. Dr. Duarte's here and ready to, and Rumiyana, thank you for joining. Feel free to, okay. So Mustafa is from India and he has a 45-day-old baby. The right half of the baby is red, which fades slightly when the baby is calm, but doesn't fade completely.
The entire right half?
Yes, he actually wrote to me about this and I asked him to take a video. And he said that when the baby is calm, it almost, not the face, but the body part, it disappears.
But the face remains.
Right.
Yeah.
Right.
If they can de-identify the baby, like cover the eyes and maybe have a look, I think it would be helpful. to see that, because there are some physiological phenomena where you have this half body flush. That's something that kids outgrow. But if the facial area sounds like it may be more of a capillary malformation if it doesn't fade.
Yeah, Mustafa, you can put a picture there, like just attach it. I think we'll be able to see it if you attach a picture. Hi, Ivana, a medical assistant at Children's Skin Center. Hello. So Mustafa, if you want to, I think you can attach pictures. I'm not sure because, you know, we're just new to this StreamYard, but let me see if you can, if it lets you attach. It says paste. So paste is a feature, so you might be able to use paste to put the picture in there. I don't know. But you can also email Dr. Duarte, oh, you can't attach it. Okay. Well, you can, might be able to use email Dr. Duarte. I just said that. Yeah, so her email.
I just put my email in the chat, in our chat. You can share that, Linda.
Oh, I can't because I'm on my phone is, I can't go into my messages. It's PDDermDoc, right?
Yep. PEDIDERMDOC@AOL.com.
So Mustafa, just send her that picture right now if you want, and then she can look at it. She can see it right on her phone while we're talking. I thought that was a very interesting case. I believe I saw the baby's head picture. I also, well, I guess this is a good question for you, Dr. Duarte, if you get one. So, you know, they're from India and probably we'll say type 2 to 4 skin type, right?
Correct.
So when those babies are born, they're very fair, right? It takes a while for their pigment to completely stabilize. Does that have anything to do with why they may like fade out or anything? Does that, or no?
No, what he's talking about, which I think is maybe what he's describing, is what's called a harlequin color change. And it's just a transient physiologic change, but it doesn't have to do with melanin. It has to do with blood flow, but it usually spontaneously improves. Yeah.
Okay.
But again, it should all respond the same way. If there's an area that isn't changing, that's more persistent, there could be a component of capillary malformation.
Right. And you can always do the blanch test, right? Put your thumb on it and see if it blanches. And that's usually a sign that it's a port wine. So if he does it on the body where the birthmark is, or the mark, we'll call it, because we don't even know if it's a birthmark. If it doesn't, then just watch it and take pictures and see if it just disappears on its own.
It sounds to me like they call it a harlequin color change, and it's transient. It's kind of like a cutis marmorata, but it has a different physiology and it's well demarcated. It's half the body.
Okay. So,
but usually doesn't require any treatment whatsoever.
That's good news. Oh, okay. So Mustafa, you can send her the picture. Welcome. We have Lisa. Hi, Lisa. You can ask any questions that you want. Eileen, all of you that are on, please, we have, this is your opportunity to direct, Rumiana, please feel free.
Linda, look, you can have a look. This is just from the internet, so it's not a patient of mine or anything, but you can see how it looks like it might be a capillary malformation, but this is an example of the harlequin color change.
Wow. So that just fades out on its own.
Yeah, it's kind of, it comes and goes.
Interesting.
Yeah.
Okay, so let me just see on here. Okay. So we're waiting for your questions, and I'm sure you can check and see if you got I mean, I know Mustafa's still on. Mustafa, did you email her now while we're on that picture? You might be fudging around to try to get it to go, but just let us know. But it was remarkable from what I saw the face, it did look like a capillary malformation. But when he said, you know, will it fade out like the body does? And I'm like, what do you mean? And he's like, well, when the baby's calm, it disappears. And, you know, we did that paper on the vanishing port wine.
Mm-hmm.
That was something different. I don't know.
Yeah.
Maybe it is a form of that. I don't know.
It
But
could be. Yeah.
you know, I'd love to see something on that. Like, I would love some pathology, but what are you going to do? Take it when we think it's the birthmark? How do you know?
Yeah, it's hard. I think
Really?
you have to tell clinically because it's going to be coming and going like a cutis marmorata.
Mm-hmm. And you're still using, are you getting the VBM Pro, or are you just
Yeah.
sticking with, you are? Okay.
Yeah, it's
You don't-
coming.
It's coming, I know. Dr. Nelson was supposed to have his this week, so I don't know if he got it. So you'll be excited to have that. And when you do get it, you have to let me know so I can put it out that you now
Of
have the
course.
Pro. And now there's a lot of talk while I'm waiting for questions to come in. I'm not a big fan, and neither is Dr. Geronimus or Dr. Nelson, with this PDT, but there's a lot of buzz about it. What are
Yeah,
your thoughts about it?
I mean, it's been going on for a while. I think for kids, we're still waiting because they have to do the adult studies first, and there are potential side effects because it's like inducing a porphyria, right? And so you
Right.
become super sensitive, and then you get exposed to this light, and then you've got the target in the malformation and the light, but there's a high risk of severe inflammation.
And then
Even
you can't go out in the sun for weeks.
I don't know how long, but definitely for several days. So it kind of makes you a little bit of a vampire, so to speak, or a little werewolf. Because yeah, you cannot get any sun exposure. It feels like you're burning. We do PDT sometimes for cosmetic reasons. We use Levulon it's a topical PDT. Now, when you're talking about these capillary malformations, it's actually intravenous. So it's a systemic effect. So it's a lot more potent. I don't know if there's a place for it, maybe with just a topical Levulon type. Aminolevulinic acid is what it is topically to induce a photoreaction. We do it for precancer, sun damage, even photorejuvenation, just to undo old sun damage.
Interesting. So Mustafa he said he sent it, but he said also, when should we start treatment? And okay, we will see you in Bucharest, and Dr. Coletti will be there to do the ultrasound. So he said he did send it.
So starting treatment, you want to start treatment as early as possible. I mean, if it's not fading out and it's diagnosed as a capillary malformation, you want to start treatment early. I think that's definitely been supported in the literature for decades now. I'm trying to see if I can find it.
So those of you that are on, you can ask your questions while we're talking. Lisa and Eileen and Ramiana, Ivana, I see you all on. This is your opportunity. Another big chunk of questions is, and Dr. Cohen and we did a study, and they're presenting it, that there are a number of babies that have been put on the beta blocker that their ulcerations got worse.
Yeah. So ulcerations are the number one complication of infantile hemangioma. So we're kind of shifting gears. We were talking about capillary malformations a moment ago. Now we're shifting gears to the most common vascular tumor we see in infancy, which are infantile hemangiomas. And the most common complication that you can get with those is an ulceration, and they can be very painful. So this is particularly at risk in patients that have segmental hemangiomas. So you always want to start the beta blocker and titrate slowly. So if I would go from 1 milligram to 2 milligrams to 3 milligrams over the period of 3 weeks, I might do that over the period of 6 weeks, much more slowly, especially if during the process of treatment an ulceration develops. So there's no doubt that there is a correlation, because this medicine is going to vasoconstrict, and in vasoconstricting, you can start involution, and if you trigger it very rapidly, it results in an ulceration.
So it's like apoptosis, is that the correct term? Like it's or necrotizing it, like almost.
It's actually, I think there is a component of apoptosis as part of the mechanism of action of the beta blocker on the hemangioma, but this is, I think, more purely vasoconstriction.
Okay.
And
That's
just
very
shutting off the blood
interesting.
supply, you get some ischemia and you start to break down more quickly than with that natural involution that happens over many, many months and years. So in some cases this happens, but it's rare, and it's mostly in the larger segmental ones that are at risk for this.
Yeah, we've been seeing that.
And I just wanted to interject one other thing. If you do get an ulceration, the pulsed-dye laser on a very, very low energy setting can really be therapeutic in healing that. Really, even after one treatment, the pain goes down tremendously.
Dr. Cohen also suggests, if it's ulcerating, to lower the beta blocker dosage.
Yeah, I mean, if you are already at therapeutic dose, you can definitely lower the dose. So when they did the studies, they studied 1 milligram per kilo and 3 milligrams per kilo, and they found that 1 milligram per kilo was therapeutic. We know that 3 milligrams per kilo is more therapeutic, more quickly efficacious, but 1 per kilo is also therapeutic. So you can definitely titrate down. And we do that if the kids have sleep disturbance, for instance.
Yes.
We know that's dose dependent as well. And we'd rather the patient get the medication, and it doesn't have to be all or nothing. We can definitely tweak it.
Yeah. So Mustafa, you already answered his questions about.
So I have a picture here of the baby. I received
Yeah.
Mustafa's picture. It's really hard to see because I'm only seeing, the cutest little face, but it's very, very light. It's very, very light. And there is some pigmentation already. So in the sense, it's a little Indian baby. So you have to be very careful. You can definitely go ahead and try a little pulsed-dye laser and see if it helps to lighten this up. But I would start a little bit more gingerly so we don't get a lot of post-inflammatory pigmentary alteration.
Right. So I've already instructed him to look on our website, because we have about 8 or 10 doctors from India in different locations, and they say under their picture what they treat. So I did recommend to him to go there, because I'm not familiar with where he lives and who would be the best. But he's asking you if you know of anyone in India that could start it.
No, I can ask my colleague though, and I can get back to him now that I have his email, because I do have a colleague that's Indian and she lives in Delhi part of the year, and I can ask her. I did want to make one little comment. It does involve the eye area, so having the baby checked for glaucoma would be important. If it is a capillary malformation, that's really quite the most important thing that we could do at this age. And if this does turn out to be a capillary malformation, because of that distribution, we have to think of possibly the Sturge-Weber syndrome. So all of those have to be taken into consideration. Hopefully it's just that harlequin flushing color change that is transient. But I think the eye on the affected side, the lids seem a little bit more swollen than the other side. So again, it could just be, I'm just looking at one picture, not the patient, so it's not probably doing it justice, but I would definitely get the eye checked. And if this is not lightening at any time during the day, it's always persistent, I think that we can say it's a capillary malformation, and try some laser, get the eye checked by a pediatric ophthalmologist, and see what the pediatrician says about working the baby up for Sturge-Weber.
Agreed. Hi, Isabella. Thank you for joining us. Please feel free to ask any questions regarding treating port wines, treating hemangiomas, lasers, settings. I'm always getting, like, you and I both know that there's so many variables with a laser treatment. There's the technician themselves, there's the settings, there's the density or level of involvement of the port wine even, and how the capillaries weave through at different levels. So it's often hard when people say, oh, is this a good result? And, what I basically say is it getting lighter? That's it. But
well, I think we have to look always at the laser tissue interaction. So when the child goes in for therapy, for the laser treatment, are you getting that good purpuric response? And if you are, you're getting a very effective treatment. Now, there are some dermatologists that like a sub-purpuric treatment endpoint. There's not that many dermatologists that believe that that's the best way to treat. More of us like a good purpuric response, but even amongst ourselves, we disagree with that a little bit. So for instance, if you use a pulse duration, which is one of the parameters that Linda was talking about of 0.45, that just means that the blast of energy is going to be delivered in 0.45 seconds versus 1.5, right? Where then you've got a longer time to deliver that. So you're going to go from more bruising to less bruising. And then if you put the pulse duration at 3, let's say, that's the same energy going over the 3 milliseconds. So again, even less purpura, but you are getting the energy delivered. You're just delivering it more gently, so to speak. So those are some of those parameters that Linda was saying, to look at the pulse duration. So lower pulse duration is more bruising, longer pulse duration is less bruising. Then you look at the energy. So you might start with an energy of 6. So with my hemangiomas, because they are at risk of ulceration, I start more gingerly, more conservatively at an energy of 6 and a pulse duration of 1.5. But a port wine stain, I'll start perhaps at an energy of 7 and a pulse duration of 0.45 because I'm more confident. Those rarely ulcerate. The end point is a bruise. We don't want to get blistering. We don't want to get post-inflammatory hyper or hypopigmentation. So if you're getting the bruising, the purpura, without blistering and pigmentary change, then that is the ideal therapeutic endpoint. But to what Linda was saying, the little capillaries in that port wine are at different depths and they have different diameters. And so the laser is going to target, depending on whether you're going higher or lower with higher or lower energy, shorter or longer pulse durations, you're going to get to different levels of that capillary malformation. So it's good to vary the parameters. So sometimes I'll go with 0.45, sometimes I'll go with 1.5, sometimes I'll go with a lower energy, sometimes with a higher energy, depending on how the patient is responding. At each and every visit, it could be a little different. So we adjust.
So it's interesting because Dr. G has stated that the new Pro leaves very little purpura.
Yeah, the new Pro leaves little purpura, but you can still get purpura. And even with the Pro, you can get more or less.
Right. But because some of the patients were like, did I get a good treatment? And he's like, yes, you did. But, it's just doesn't have that heavy amount of it. So
yeah, it's just possibly using a longer pulse duration, and the Pro is extremely strong.
Yes.
So we're going to be much more conservative in the delivery of that energy.
Important.
And it also, because the spot size you have to also look at the spot size. So we talked about pulse. These are questions to ask your laser surgeon. What's the pulse duration? What's the energy? What's the spot size? Because also, as the spot size increases, that energy is going to be delivered over a larger surface area. So it's a little bit less intense in the delivery, but it's still all that energy. So I believe that the Pro has a 15 millimeter spot.
It is.
Yeah. So
and it's deeper, faster, and
correct.
quicker.
Correct. And
So,
it's got a very nice cooling device that it kind of glides along the skin and cools it as it goes. A little different than the Perfecta that shoots the cold liquid, the DCD. So it's definitely a nice advance.
Yeah, it does cool, zap, cool. So it does pre-zap, post-zap.
Yeah.
Which I'm very
But
happy.
a lot of doctors don't have the Pro yet. It's, far and few between because it's just being released in this last year. And so, Yeah, that's another important question to ask the laser surgeon. What pulse dye laser are you using? Is it the Perfecta or the Pro, or even before the Perfecta was the V-beam? And they're all good. They're all really good tools to help these lesions, but certainly the Pro is the latest and the greatest. And it was so strong they recalled it and then they relaunched it.
Oh, well, yeah, I heard that it was like the handpiece.
Yeah, it was called the Prima, and
Well, the
it
Prima
was,
one, the Prima, yes,
and now it came out as the Pro,
right,
which is great. They worked out some of the kinks.
right, true. Oh, Mustafa said that the glaucoma was ruled out. That's great. Brain
Okay.
was clear, great. All look remarkably good. He said it's not persistent. It does lighten. So maybe just observation for a year, even to see if
Yeah, I mean, it's not too late to wait a year.
yeah.
The other thing I was going to say that can help also with Mustafa's baby is they can check for the gene NAC mutation. That's a mutation that they see in Sturge-Weber. So that's another point that could maybe be checked, and the child, they could be reassured if that's negative.
Right, that's the GNAQ mutation.
It's
Right.
with a C, GNAC, but
Oh,
we call it GNAC. Yeah.
oh, okay. I thought it was. Is that a different one than the GNAQ?
It may be.
Okay. Alrighty. And then I wanted to say hi to Erica who joined us, and others are just watching and listening. But please, we have Dr. Duarte. She's a world-renowned expert. We have 26 minutes left. Ask your questions. We're filling in with new developments and lots of good feedback with the Pro. It's rolling out in the US, so more and more people will have it. So we'll be able to get some more data, the more people that have it. But I know that Dr. Bernstein and Dr. Geronimus love it. They just love it. They just think it's great. And at our free conference in New York City, in which Dr. Duarte will be there this October.
Yes.
So you'll see her. She'll be running the derm clinic with Dr. Cohen and Dr. Hashemi. And so that's another way you can see her. And we do the free laser, we do free ultrasound, free dental, and now we have free glaucoma checks. So Dr. Panarelli, who joined us last year, you didn't get to meet him yet, Dr. Duarte, but he is pediatric and adult glaucoma expert. And he just opened his own practice, and he has some new small handheld devices that he's going to bring that he can actually do readings
Okay.
for the glaucoma check. So I'm really excited about that as a new service. So for anybody considering getting a laser and wanting to get a glaucoma check, dental, please remember birthmark.org, and you'll see the top one is Dr. Duarte's clinic, which is tomorrow. And then you'll see Bucharest and you'll see New York. So make sure you check that out if you want it.
Just for those that are online and watching, it's a great clinic. It's a really great resource. I hope that anyone that can takes advantage of it, or tell your friends or anyone else that you know that has a vascular birthmark. It's a really great clinic.
Right. And we do, like I mentioned, it's not just a free consultation, free laser, free ultrasound, but we also do the free hotel for one night. And we do parking because we know nobody asks for this. And we know it's hard for you to get to New York. So we try to make it as easy on the family as possible. And trust me, they come concerned, but everyone who leaves with an accurate diagnosis. That's why we have the ultrasound and world-renowned experts there, because as I stated in my post this week, and you can check with ChatGPT, you can check with AI, or you can Google, and it's still 60% of the patients with vascular anomalies are misdiagnosed. The misdiagnosis rate is 60%. That means more are inaccurately diagnosed than accurate. So that's why it's important to come to one of our super clinics or to go to one of the VBF experts. Dr. Duarte runs her own practice, but she has a team. She has Dr. Restrepo, who's the interventional radiologist. You have surgeons, you have everybody there. So you have a comprehensive group that if patients go there, they can get taken care of. Okay, so Rumyana wrote a letter. She's from Bulgaria. Her baby is 40 days old, port wine on left eye, forehead and scalp. At what age to start with laser over eyelid area? Also regarding Sturge-Weber, at what age to start with neurological tests? How to check for the gene mutation.
Oh, okay, great. So the earlier laser therapy is started, the better. I think that's, again, well accepted. We can use an eye shield to protect the eye from the laser so the lid can be treated. Babies do quite well. It's a quick treatment, very fast. And as Linda was mentioning with the Pro, it's even faster now. As far as the eye, definitely get checked for glaucoma very early on. That's really the riskiest component to the potential for Sturge-Weber. And then see a geneticist and get checked for the GNAC mutation. That would be really the way to go. Neurology, you can talk to your pediatrician. I know with Dr. Comey, she recommends that an MRI not be done before age 1 year because it's not going to be reliable unless the baby's having seizure activity that's physically apparent or suspected. Then definitely you want to wait till the baby's 1 year for that MRI, but it is recommended to do it at 1 year even without any seizure activity.
I just saw a study done by Dr. Pinto and Dr. Comey reevaluating when to begin the MRIs.
Okay.
So she'll be sharing that with us, but she said that preliminarily, she said, now they may be moving it to as soon after it's seen, like infancy.
Right.
And I have to see the study, but that will be a big change if that's the case.
Yeah, I mean, if that's the case, for sure. I mean, I know that the last time that I heard her speak, which was at the clinic, she mentioned the 1 year mark. I know she's doing a lot of publications, but certainly if there's any seizure activity, you're going to get that MRI at any moment.
Right, exactly. So we have a question from Erica. What is your experience or opinion on treating the eyebrow of a port wine in a 5-month-old? Her eyebrow hair is starting to thin, and I don't know if we should stop or continue when she's older. She has amazing clearance with the rest of her face so far.
So as far as the eyebrow, it can be protected with, there's a gel called Surgiloop, and it really helps the laser go right through the hair and right just to the port wine. There's going to be a lot less singeing of the hair if you use the Surgiloop. So that's something that's quite easy to get. If your laser surgeon doesn't have it, you can bring it in. Of course, it's going to be up to them and their comfort level, but it's extremely safe. We use it all the time to protect the eyebrows, even the eyelashes when you're treating close to the lid margin. So it depends. Sometimes it's gonna depend on each patient how much port wine there is in the eyebrow and how much treatment, because no matter what, even with the protection, you're gonna get a little bit of stunting of the hair growth, but it is thought to recover over time. So it's not permanent, even though it can stunt it, it will come back. In general, but you want to protect it because otherwise you will singe it and you're going to have a lot of temporary eyebrow loss.
Thank you for that. She says she's from New York. So Erica, are you seeing either Dr. Bernstein at the Laser Skin Center or Dr. G? Just out of curiosity, because I had talked to Dr. G. I actually said, well, can you use something like betadine, and put it on the brow, because then the laser will bypass it and go right. But he didn't respond. But the Surgiflow, now I'm going to research the Surgiloop. I'm going to research.
Yeah, the Surgiloop, it's actually what Roy uses. Yeah.
Oh, okay. So
I think I got that tip from him way back when.
Okay. Amy is from Calgary, Canada. They have a 5-year-old with 40% port wine coverage on his face. He's had 24 treatments since he was 3 with Remington. That's Barbara, who comes to all our clinics, partner Todd, Dr. Todd Remington, and Barb comes to our clinics. So it's a great team. Yes, you do have an incredible team. Who do I reach out to for genealogy? We are looking forward to seeing you in the fall. Oh, she means genetic testing.
It depends on your institution. It's usually done by the geneticist, and most pediatric hospitals will have a geneticist. Or you find a team of a center that has a team of vascular anomaly specialists, and someone on that team will, in our team, it's the geneticist that does that testing.
So Erica, this is all pretty new. And if you're on my Facebook page, which is my name, Linda Roselle Shannon hyphen, and scroll down, you'll see I announced a new group out of Canada called the Vascular Anomalies Alliance of Canada. And it's a group of doctors, actually, and it's a foundation, but it's all doctors for vascular anomalies. And you can write to them and find out who is the geneticist on the team, because he's got over 100 doctors now that are on that team. And I've been working with him to get the word out to families from Canada that they now have this countrywide group that serves all of Canada. So check that out, Erica, and I'm sure there'll be a geneticist in there. Hi, Amy. Thank you guys for your questions. We still have 16 minutes left, so feel free to ask your questions. And like Erica, you can also Google, I know I did a post about it, so it's on my front page. I did it a couple weeks ago, and you'll see the graphic image for the Vascular Anomalies Alliance of Canada. And I believe it has their website link on there. So then you can email them directly. And I think that the guy, their vice chair, is a Dr. Philip John is his name. And he runs it. So I'm so happy that they're doing this in Canada, because so many of those patients come to the US for treatment, but it's just a matter of finding it out. I had the same thing with the UK. Everybody was going different places. And then I got a group out of the UK saying, hey, tell them all to come to us. And I'm like, I didn't know you existed. Thank you for letting me know. So sometimes it's just a matter of not knowing.
Exactly.
There's a comprehensive team there. Oh, great. Thank you. So thank you. Kiana found the link. So thank you for that. So Erica, Kiana just posted with the VBF logo. You can say where she wrote, found it. So that's the link. Where you can see the Vascular Anomalies Alliance of Canada. And okay, so I don't think we missed any. If any of you, and Rumiana with the 40-day-old baby with the forehead and scalp, we do have a free laser clinic in Bucharest in July. Check out our website at birthmark.org and scroll down until you see it's Dr. Iona Pescaru is the derm expert for the whole country, really. She's the derm expert, laser expert. Okay. And before we get a question, I would like your opinion.
Sure.
And I know it's mostly pediatric, but you do adults as well. What are your thoughts on tattooing on a port wine stain?
Well, tattooing an area that hasn't cleared completely, using a skin color tattoo.
No, like I saw recently a girl has a red port wine
Mm-hmm.
on her arm. So she had flowers all over it.
To cover it.
To cover it.
Oh, I got you. So, I think it's okay as long as she's okay with it having a tattoo. That it's very hard to remove tattoos, but I don't think I don't know how the color is going to look exactly.
Right. Well,
because you're not tattooing into a regular dermis, right? You're tattooing into an area with a lot of red. So I don't know how the colors are going to be impacted.
Well, the other thing that I know Dr. G says is not all stains are aging, but the ones that do will have texture changes over time, and that can change the color. So he doesn't like it because then he says you can't treat it if it becomes blebby or thickened, then it's so I always say to people, if you want it, you better think about all of the repercussions.
Just tattoos in general, right? It's quite permanent.
Yep.
I have patients without port wines that get tattoos and have all sorts of allergic granulomas and persistent folliculitis. And I mean, yeah, it can happen.
So we have a question. Marianne, she's 86, in need of some laser treatment due to some changes on her port wine because of her age. Do you know of any dermatologists in the American Fork Provo, Utah area where I could go for treatment? Utah?
I'm sure there are lots of dermatologists out there that can treat her. Just email me and I'll look someone up. I don't have anyone off the top of my head. Do you, Linda?
Yeah, I think we have, the guy used to be Treat was with the Boston Children's Group, and he married a woman from Italy, and she's the derm laser expert. I'm trying to remember. It's not Richter or something like that, but it's the Utah Vascular Anomalies Center or something like that. And I think she actually spent some time with Dr. Geronimus. So I mean, if you can find it, otherwise you can write to me and I'll find it, but it may be on our website. So if you go to our website where it says find a doctor and you click on it and you put in Utah, you will probably find him. I just can't remember his name. It was Treat or Trainer. And then she was the derm with him and she's doing the laser because she also communicated with Dr. Coletti about how she does it. So we have another question. Marianne, if you want to email me too, I'll help you. So Erica says, for the patients doing weekly laser as a baby, what do you anticipate their maintenance to be? Is it a few times a year? Also, what do you suggest for baby sunscreen in between laser?
So for babies under 6 months of age, if you read the package insert for most sunscreens, it's going to say don't use until 6 months of age. So in general, we want to do sun avoidance. You want to go out when the sun isn't as strong, later afternoons. You want to wear a hat, protective clothing. And then on those areas that are exposed, you can use a little bit of sun protection. And you need to use the sunscreen and reapply it every couple of hours. If you have recently been treated with laser, you really want to avoid the sun because getting any pigmentation in the skin, the melanin will compete with where the laser target is, which is the oxyhemoglobin, the oxygenated red blood cells is what the laser targets. And the melanin, when you look at the curves, you can see the melanin is right there close by. So if you increase the amount of melanin, it's going to be harder for the laser to penetrate. So we want the skin to be as light as possible for the laser to be effective. So I would say that we don't want babies in the sun too much. And when they do go out in the sun, try to protect them as much as possible.
Do you have any favorite brands of sunscreen that you recommend?
So I like Blue Lizard. I think it's a really great sunscreen for kids.
I hear that a lot, Blue Lizard.
I think I like the gimmick of the Blue Lizard, which it comes in a white bottle, but when it's exposed to sunlight, it turns blue. And so the parents don't have to be the ones to tell the kids to put it on. The bottle can do that. So there's none of that back and forth. If the bottle turns blue, the kids know that it's time to apply their sunscreen.
I love that.
Yeah.
She also asked you about maintenance. Like what can somebody expect once they've reached maximum clearance?
So in general, we know that these will recur because they're a malformation. So if you're lucky, you'll never need another laser treatment. But most of the time, even the ones that go away completely, 2 or 3 years down the line, you may start to see the footprint of that malformation again. And then it's going to depend on how much. It may be once a year, twice a year, but certainly it's not going to be weekly forever. That treatment interval is going to grow. And it's going to grow, rather quickly, especially now with the Pro, because the Pro does go deeper. So we have to see how it goes. But I mean, we may be closer to a cure, so to speak, or really clearing these on a more permanent basis, hopefully.
You mean with the new lasers?
Yeah, with the Pro, yeah, because it does go a little deeper.
Yep.
And it does so safely.
There's a lot of talk too with the new genetic editing and so forth. Like, will that GNAQ and GNAC be able to be targeted with that CRISPR, they call it, the CRISPR, the editing. So, I mean, there's some talk within the neurology society about that I've read about recently. And I'm sure we won't hear or know about it for another year or so, but I keep texting Dr. Comey and saying, do we know anything more? She's like, I'll let you know, but that's coming down the pike. So I'll be happy to learn about that. So yeah. And also I think the parents need to know about, no two people may have the same maintenance program.
Exactly.
Right?
It's individualized.
And the same thing with clearance. The clearance can range from 50% to 100.
Absolutely.
And even if you've had 50 treatments and you're only 50% clear, what I tell people is if you have more than 2 sequential treatments, so a third treatment, and there's no change in those 3 treatments, then you've reached maximum. That's as far as it can go. All things being considered, that you've maximized the settings.
Correct.
Everything's been maximized, then you have to accept that's for the day, for the time period, for the device, that's the maximum you're going to get.
Right. And then you can take a break and then come back to it. Perhaps the malformation will recur a little bit 6 months down the line, and then you have more target again.
It's a good point. But I mean, if they're getting, I had a woman tell me she's had 130 laser treatments and she clearly was not cleared, and it was bilateral. And I said, well, how much clearance have you had in the last few? And she's like, I haven't had any clearance in the last like 20.
Wow.
And I'm like, well, why are you still doing it? And she goes, I just thought I was supposed to. And I'm like, because the laser can't reach what it can't reach, right? That's it.
I mean, there is that philosophy that perhaps it's helping it maintain. Perhaps there's some that while they don't clear, as long as you're getting a good endpoint, if she's getting good bruising, then I think, she is getting something accomplished. It's just not going deeper, but perhaps that would be one of those that would get really cobblestoned or more hypertrophic, and she's staying on top of it. So she needs that. What I'm saying is, if you're not getting that bruise, and now with the Pro, with some of the settings that are being used, if there's less bruising, it might be more difficult to tell, right? But at least for me currently with the Perfecta, if I'm getting a good, that laser tissue interaction, that endpoint of bruising, I know that it's helping. It's doing something. If a patient comes in and I do a treatment and the patient leaves exactly the way they came, then I would probably say, hey, we've reached a plateau and we're not targeting anything. So we're going to take a break and we'll see you in 6 months and see where we're at.
I just wanted to be, as we're wrapping up, I really think it's so important, especially with, the warm weather for the rest of us. I mean, you've always had it nice and warm in Florida, but it's starting to warm up. It's so important that, number one, parents will say, I have a newborn baby. And I say, well, you're not supposed to use sunscreen on that baby before 6 months, period, end of discussion. But then you see the pictures on Facebook and their baby's in the pool and has a port wine and just had laser and there's no hat. I mean, the water is the worst place because of the reflectivity, right? Yeah. Should they wait for the purpura to be completely healed before they go out into the sun?
I think if you are under active laser treatment, it's going to impede the treatment if there's tanning going on, which is going to happen if you have skin exposed to the sun. That's just the natural reaction. That's how our body protects ourselves from the sun, right? With a tan. Right. So I would say that, you can use the sunscreen because I think that's better. It's not approved, but we do all sorts of off-label treatments and uses all the time. So if you're going to be in the pool, then yeah, and you're going to wear a little hat, and you're going to do everything you can to protect. And then you use your SPF of 100. La Roche-Posay makes 100, and you just want to use it in a limited fashion. You don't want to do head to toe on a small baby, but do sun protective behaviors, and definitely apply the sunscreen, because it will impede with the treatment.
Yeah, I'd like Kiana to put that in the chat. So that's La Roche, is that LA capital ROCHE?
Yes.
Yes.
I
That
think
La
so.
Roche. Yeah. So if you can put that in there, because people will text me and say, "What did she say?" That
Yeah, it
it's
has an SPF.
Yeah,
They
100.
and Neutrogena. Neutrogena also has an SPF of 100. So I would
Right.
say that you can use that in limited quantities. One little other detail, when you're using creams for the first time on a baby, because we don't know how the baby's going to react, you do what's called a use test. And so you put like a little dime-sized amount somewhere and cover it with a little Band-Aid and wear it overnight, just to make sure that there's no allergies or any kind of reactivity. And wear it overnight, and then in the morning check it. And if their skin looks just fine, most likely it'll be good to go.
Yep. Yes, Kiana, it's La Roche, capital L, small a, capital ROCHE. And that's 100 SPF, and also Neutrogena is 100 SPF. So they can find that or Google it. We're down to the last minute.
Yeah.
One quick question for you. So I've seen some babies with type 2, 3 or higher brown skin and have hypopigmentation happen from the laser, where they end up with white spots.
Yeah.
Will that resolve?
It will, but it's going to take a
Should they
while.
get laser? Why that's resolving, or would you recommend not to have it lasered until it resolves?
I personally don't laser through that. I let them recover before we do another laser. And hyperpigmentation as well, because remember, as I mentioned, the more tan the skin is, the darker the skin is, the harder it is to get the laser through there. So I would wait.
I'm just typing this in. The Neutrogena or the La Roche. There you go. Well, we are at the hour, and it's been very informative. And this is going to be a very good video for us to take some sound bites out of, for sunscreen, hypopigmentation, laser settings, to remind people of these important facts and to share them with our new moms. So thank you, and I will see you in the fall.
Yes.
At our clinic, and good luck with your clinic tomorrow. And as always, thank you for everything that you do for the community.
Thank you. It's a pleasure to be here again.
Thank you.
Bye.
Bye.